Hey everyone, another video today, this one on just a brief overview of infertility. We have a lot of patients that are coming to see us at the Pearl Women's Center for a variety of reasons, and one of those reasons is that our patients are interested in trying to get pregnant and they're having trouble. In some cases, they've had their fallopian tubes interrupted with a tubal ligation, and they may come in for fallopian tube reconstruction or tubal reversal surgery, and that's a fairly straightforward management of infertility for patients. But I think it's really important to kind of explain and maybe stratify the various reasons why humans have trouble getting pregnant. So on one side we've got male factor infertility, and on the other side we have female factor infertility. Male factor infertility is fairly straightforward in the workup. We typically recommend that a patient goes in and gets a sperm count and an analysis of the seminal fluid to make sure that there's an adequate amount of sperm and that their motility and their morphology, their shape, is normal. We typically don't go much further in our workup until we know that the male factor is okay, because sometimes the female factor infertility may require more intervention like surgery. We always want to do a hormone assessment and make sure that the central hormones like the thyroid, the pituitary gland, that those, and even the hypothalamus, that those hormones are all working in sync and doing the right thing. So we typically get some labs on the third day of the menstrual cycle, meaning day 1 being the first day of bleeding. On day 3, we'll have you come in and get some labs to make sure that all the hormones look normal. We would then get an extensive history to make sure that there isn't a reason why the sperm and the egg are unable to meet. In patients that have had a history of pelvic infection, for example, there could be a blockage, and it may make sense to do an x-ray study or even do a surgical evaluation to make sure that the uterus and the fallopian tubes are working well. There's some other reasons for infertility as well. Women that don't ovulate are not going to get pregnant, and that's actually one of the biggest reasons why women don't get pregnant is a condition called anovulation, or lack of ovulation. That can be assisted with various medication. So overall, again, there are a variety of things we need to think about, but to simplify it, really the sperm and the egg need to meet, they need to fertilize, and then that fertilized egg needs to get to the uterus and implant in the uterus. So if there's an anatomical problem like a fibroid tumor, that may prevent implantation or even cause miscarriage. If there's a problem with the cervix, there can be a problem even carrying pregnancy or possibly a blockage. Same thing as we mentioned with the fallopian tubes. Again, if you have questions, you can always reach out to the Pearl Women's Center. We are more than happy to see patients for infertility management. We do work with a local group called Oregon Reproductive Medicine for patients that are more interested in pursuing in vitro fertilization, which is the concept of taking the sperm and the egg and fertilizing outside the body and then placing that embryo inside the uterus. Again, look at our website for information and feel free to reach out for questions. Thank you.